So lovely to see you all. Happy equinox. My name is Janice Duddy. I'm an independent consultant that was asked to come and support the project, and I'm calling today from unceded territories of the Semiahmoo, Kwantlen, Katzie, and Stolo people. So thank you, Mark, for the introduction. Feel free to jump in at any point here, but just to kind of let folks know, I was asked to come on board to help do some consultation work with Get Checked Online implementers. So people so Get Checked Online's been operating for 10 years, so it's important to kind of gather lessons from folks that were involved early on and who maybe not as connected with the project now, and then current implementers as well. And the thinking around this was to document and gather together key lessons learned around implementation, to share it out with other people, other teams and agencies that are doing similar digital innovations or digital testing or healthcare initiatives. So what we're working on now is pulling all those findings together into two resources. So there'll be one that will be a technical summary, so sharing the lessons that we learned through the consultation pieces. But then also we're working on developing a how-to guide that would be helpful for other teams who might be embarking or engaging with these digital innovation kind of projects. And this is built on the shoulders of a lot of other work that's happened through by the team, looking at implementation lessons learned. So some early work by Shannon Kopp, and then Aurelia, I saw you were on the call too. So early work that Aurelia did around some of these pieces as well. So just to okay, so just to talk a little bit about what we did. So the Get Checked Online core team was engaged at both the beginning and at the end of the process, the consultation process, in the beginning to help me contextualize some of their key learnings around implementation and to use that as a guidepost in talking to other implementers. And then at the end as a way to kind of check in and see how my interpretation of what I heard, whether it was a good interpretation or like whether there was more context that we needed to wrap around some of those places. The consultations happened between October 2024 and January this year. I was able to speak to 45 people and a number of different online calls from multiple regional and provincial organizations involved in implementation. And this included people from the clinical context, from public health, from the private laboratories and other laboratory teams, government and community sector. So like a really good swath of different people that had been involved in different implementation steps. We used a framework called the Consolidated Framework for Sustainability Constructs in Healthcare as a way to kind of guide the findings. And so I worked from my observer notes to place the lessons or the findings into this framework. So I was going to share with you some of our very high level findings. There's a lot more detail behind all of these, and we'll be sharing those shortly, but just some of the things that we learned. Oh, and just to kind of outline the steps in the Consolidated Framework for Sustainability Constructs in Healthcare. These are the 6 different areas that it looks at. So at initiative design and delivery, around negotiating initiative processes, people involved, resources, organizational settings, and then looking at external environmental contexts that may impact a program. So first of all, we're talking about key findings. If we look at initiative design and delivery, many of the people I spoke with through the consultation felt that Get Checked Online had a clear goal, focusing on health equity and accessibility of STBBI testing, and felt like that was a really great strength of the program, as well as another really important strength, and we've heard a lot about this ahead of the break, was the very integrated approach to evaluation and research that Get Checked Online has taken, and really using and engaging with evidence across the program to course correct or to adapt the program. But that like ongoing learning process was something that a lot of people I spoke to really kind of highlighted as a really important piece of Get Checked Online. Around design and delivery, negotiating information technology systems was sometimes challenging and evolved like over 10 years as well. So it was a lot of adapting and that needed to happen with the IT systems. Um, if we look under the category of negotiating initiative processes, so people felt it was really important to define clear governance structures and accountability mechanisms for Get Checked Online. That early and ongoing engagement with senior leadership and funders was really important. And that there was a need to reevaluate human resourcing as the program expanded. So over the 10 years in time, like there's some interesting learnings of that come like for earlier on in a process like this, like around piloting and planning the process. And then there's lessons learned, and this is like in the how-to guide, we're kind of thinking through these a little bit too about like the phase of work around ongoing implementation operate operating the program later on. Can't say that word, but and there was also under this kind of in this framework, there was this thought about the need to systematize institutional memory. The Get Checked Online team has been very stable and has had like a long history working on the project and are amazing. And lots of people highlighted that as a strength as well. But with that reliance on individual champions, with deep knowledge of a program. There was some concern around sustainability if, say, one of those people was no longer able to be engaged with the program. So thinking through those pieces was identified as an important thing. So people are really the cornerstone of these kinds of projects, and this project in particular. And the one thing that became very apparent with talking to like all these folks involved with implementation is that it is really important to invest in program team members who have really strong relationship building and interpersonal skills. And that seemed like it was a really important piece and something that is so valuable. The team members that have really strong communication skills and were able to build trust across and among teams. So there was a lot of different teams and different partners that were involved in helping implement Get Checked Online, and sometimes these teams hadn't worked together before, and that having those really strong interpersonal skills was very important. And that was like a key learning for me was like it is really important to invest in like those skills when we're talking about these kinds of projects and programs. And then another thing was like, given the innovation and this new way of working, it was important to map out what the program needs were and how teams could support Get Checked Online goals. And sometimes I think it's not always obvious at the beginning, and it involves some thinking and engaging and asking questions of different partners about who does need to be involved. What are the things we need to like learn about and address and move forward. So that was interesting to hear too. So around resourcing, so Get Checked Online was established outside a regular funding system. So it was really kind of, it grew through the Stop HIV program, which was a unique funding envelope, and it allowed Get Checked Online to be innovative, but it sounds like it has created some funding challenges during the operationalizing phase. So that's kind of an interesting thing. So it's kind of that balance with kind of more in like kind of funding envelopes outside of like the system allows for innovation and changing and adapting and trying new things. But at the same hand, it takes it takes some work to kind of fit that into the existing system and existing systems and to operationalize it. And it became very obvious, even talking early on, that the Get Checked Online has really tapped into the need for many different technical expertise. Like, So things, as we said, around relationship building, but then like different like IT skills, project management, like thinking about user design pieces and business, and then some of the business case and economic modeling. All so like it's a very kind of diverse set of skills that were needed to implement Get Checked Online. And then, as we kind of heard too, like planning for sustainability is early is a really important thing, and really thinking carefully about moving from that planning and piloting phase into integrating the program into the current systems that are operating. If we look at the operational setting, so again, it's important to continue to work to integrate Get Checked Online within existing programs and services. So for looking at sustainability, this was identified as a really important thing. Um, there has been some challenges with integrating this new model of doing testing into existing systems. So there's been some things that, around IT capabilities, and that's required, say, the manual input of data into systems and things like that. So things aren't they're not haven't been seamlessly kind of integrated. So that's something that may be helpful to look at in the future. And it's important to engage operational leaders of teams supporting Get Checked Online early in the process. So kind of keeping everyone informed and keeping like kind of the leads informed and engaged throughout the process sounded like an important thing. An external environment. So I think Mark, you alluded to this. Like a lot's happened in 10 years, and I heard a lot about that and like the issue around like COVID, but also big shifts in tech and like people's like their comfort level with like say doing online testing or getting results online. So we've heard a bit about that already this morning. And then there's still some big questions that people rose through the consultation process about how to create visibility and operational support for programs like Get Checked Online in complex healthcare systems that have competing priorities. So this is still a something that is identified as a challenge and something to think through. And then some people really spoke about how they felt the system is a bit risk adverse when it comes to engaging with new innovative approaches to healthcare or STBBI testing, and that thinking through that a little bit is helpful as well. And like that we need to think about like creating like an incubation space for like innovation might be super helpful. So, as I mentioned, we're working on building a how-to guide. So, kind of taking the lessons that we learned, and from the consultation process, and then thinking about how to reframe that into kind of a recommendation or how-to guide, or here's some tips and tricks kind of document. So that is being drafted right now. So what we're going to be doing is looking at kind of key components to consider. And so we've kind of outlined these 5 kind of key component areas like for teams to think about as they're coming in and beginning to build or adapt a digital innovation in healthcare or around STBBI testing. So in this guide, we're pulling from examples from Get Checked Online that I heard about, and kind of outlining practical tips and tools, and also looking at pitfalls and things that might be challenges to look out for. So I think, yep, that's the end of my presentation. I don't know, Mark, if you want to kind of add anything more to that.
I mean, I think this has been really helpful work when thinking, like working with colleagues like Devin and Heather and others who are like implementing Get Checked Online. I think, will also help us as we continue to go forward and think about future phases. I mean, and just to think, tie this back to sort of like one of the fundamental goals of our team grant was to really understand those contexts that affect implementation, and really like what can both make implementation easier and more challenging. And I think this is a great example of some of that work that helps to tease some of those things out, particularly from an organizational perspective related to the implementation of Get Checked Online.